the most important thing for myself is to understand that when we put the scoring key together, again, this is a tool. This is not something that has been validated whatsoever. It is just a guideline. There is certainly more work that could be done in this area. Maybe at some point in time, somebody might pick up the charge. There's certainly other tools out there as well. But I think that the nice thing about the self-injury inventory that we've developed is that it does structure it out. It does help to simplify what can look like a very complicated, complex behavior. So when we did those studies around understanding factor analysis, I would say that fairly consistently the internal emotional regulation component and the social influence was certainly big. The external emotional regulation also, significant. So, and then the sensation-seeking piece, might be something that's more apparent in those risk takers, and to look for other risk-taking behaviors in those youth as well. So when we use that tool, it's really just a guideline to point us in some directions. I don't want anybody to be focused on the number or what the mean is and how does this relate to the other factor or anything like that. It's just a sense of general weighting of the functions to help the clinician and the caregivers and the youth look at, okay, this is how it seems to be coming out. We might need to drill down more in this area, for example. Then the other piece being the addictive features. That's again nothing that's been 100% established to have any validation in terms of a score or a level. It's simply are there 3 or more? Does it look like it is more heavily weighted with addictive features or not? Because if it is, then that is a whole context for looking and understanding the behavior, and then to look at what other addictive behaviors might be apparent, because one knows that if they stop their self-injury, then some other addictive behavior. I remember one youth who stopped their self-injury, but their bulimia took off, and so it's sort of like, well, and then they felt worse because I can't do anything right, and it's like, no, we understand that we're working on strategies around managing this, and that our expectations are that this is going to take time, and that relapse or symptom substitution is going to be a possibility. So I would say those are the things that I would say I've learned and come to understand more about this, but also as an understanding that this is a tool. It's not like some of the other measures that are highly validated.